Hey, my name is Ellis, and I recently posted on Tumblr asking whether it would be helpful if I made a video just briefly discussing my experiences getting prescribed tea through Planned Parenthood. And people responded that that would be a cool thing to do, so I'm just gonna make a quick video, and if people have questions past this, because I definitely won't answer every question that's out there, then please feel free to message me and ask me. Okay, so I started looking into tea a long time ago, but I was pretty determined to get tea using an informed consent model and not a medical model where they diagnose with gender identity disorder and like through a letter from a therapist, tea is prescribed. So I was looking for informed consent, meaning that the doctor prescribes a patient tea with an understanding that the patient is ready and understands the risks and the effects and all of that without a therapist letter or GID diagnosis. So I live in the South. I live in North Carolina, and there just aren't a lot of queer health things around here or trans health things. It's not common in the South, but I do live within a reasonable distance of some bigger cities. So I started just reaching out and seeing what might be around there. I heard through Tumblr that some Planned Parenthoods did HRT. So I visited some websites and called around, and a Planned Parenthood in a city about an hour away does trans masculine HRT. And some Planned Parenthoods do hormone therapy for both trans men and trans women, others don't do either, and some just do trans men or just trans women. So it's specific to each Planned Parenthood, but they all do use the informed consent model. So I called, and when I made my appointment, they immediately told me the range of costs for like the blood work and the consult appointment. And they use a sliding scale for trans health just like they do for other types of health. So they told me that it would be between $50 and $300 depending on whether my insurance would or wouldn't cover it. At the time, I didn't have insurance, so it kind of gave me a range of what to expect and what to prepare for if I were to get all the blood work done. So I made an appointment and got in within a week. When I went there, I felt very comfortable. In the waiting room, it wasn't just women. There were men there, there were children there. It felt comfortable. I didn't know if it would. I know Planned Parenthood, as most of us do, as doing women's health, but I felt that there were a variety of people there. Everybody was very respectful to me, and I felt, I felt that people were knowledgeable and sensitive. The PA opened the door to the room where I was waiting, and the first thing she said was, "Congratulations," and I said, "On what?" And she said, "On your top surgery. I see that you had top surgery in your record recently, and that's really great. I'm so happy for you." And I was shocked that she took the time to actually read my medical record that thoroughly and knew what it meant, and to be happy about, getting surgery, because it's a big deal. And so that made me feel good that she had knowledge of trans people and wasn't just like, stick you in the butt with this needle sort of thing. Planned Parenthood is really good at trying to keep costs down, and because I had recently had surgery, they allowed me to get my surgeon to fax some of the blood work that he did pre-op, so that I didn't have to get the work redone and have to pay for it. So actually, I think that there were 3 tests that I needed, and 2 of them had already been done when I had gotten surgery. So I didn't have to pay for those, so I can't speak firsthand on, what the total cost of all the tests would have been, but I did have to have one done, and it was less than $50. So that's something that I can look around for and figure out more accurately if somebody was interested. So with the informed consent model, it comes like the necessity of a doctor-patient understanding of the risks and effects of tea. And they gave me this packet called Client Information for Informed Consent. And it goes through what is tea, what are the benefits, what are the side effects, what are the risks, all the way down to how long does it take to work, can I get pregnant, what are my other choices. It's pretty cool. I could upload it if people were interested. And not only did we go through the sheet like bullet by bullet, but the doctor also asked me questions like, what do you expect from tea? What are the things that you're most hoping for? How does it fit in your current life? Do you have a support system? Like, is your life stable? Things like that. So I wasn't just like walking into a clinic and looking for a tea prescription willy-nilly. But even as she was asking these questions, it was interpersonal, and I didn't feel like she was trying to educate me or put me down or like assuming that I wasn't knowledgeable. She respected that I'd probably done a lot of research, just as all of us do, and that this is something that we think about for a very long time. And I thought that was super cool. After we had talked for a while, she even said, I could give you your first shot today if you're ready, and I said, I'm not ready. I didn't prepare to go there and get a shot, and I also wanted my partner to learn how to inject with me. So I came back probably a week later. Planned Parenthood is cool because they make a point to make sure that you're comfortable with injecting before sending you home to get your prescription and doing it all alone. So I could have gotten my shot done there multiple times for very little cost until I was comfortable with it, but since I lived so far away, I really wanted to learn how to do it quickly so I didn't have to keep driving back there. So my partner and I came in the second time, and she taught us how to do a tea shot, and I got my first testosterone shot. And it was easy. She was so confident. And I mean, I know that that might not reflect the knowledge base of every Planned Parenthood PA or doctor, but for me, it felt really good with her. She was, she seemed adept. So theoretically, I could have picked up my tea prescription at the Planned Parenthood there. If I lived in the area and wanted to do my refills there, but I ended up going to a Walgreens. She also referred me to a couple online places where I could have gotten it sent to me. Overall, my total cost for both visits was less than $100, but like significantly less than $100 to Planned Parenthood, not counting gas and stuff. But like I said, I can't speak to what the cost of the blood work would be without insurance completely, but most of the blood work is pretty standard and would be covered by basic insurance, from what I understand. So they recommend that that one comes back in about 3 months to do more blood work, and yeah, so that's been my experience. I talked about informed consent. I talked a little bit about cost and how I felt. Yeah, and I know that doesn't answer every question, but maybe it raises more questions. So please feel free to send me an ask. Ellis, E-L-I-S, in transit.tumblr.com. Yeah, let me know. Thanks, guys.